Hello, everyone, and welcome back to Atlantic Coast Aesthetics. I'm Matt with ACA, and joining us once again is Dr. Thomas Payne with the question of the week. Dr. Payne, we have this question coming from Europe, from our Facebook page, and this person, they've lost a lot of weight, but no one apparently wants to perform a thigh lift on them due to potential scarring. Dr. Payne, what would you suggest in this situation and the best course of action?
Yeah, this is a good question. It brings up a couple of interesting points. Now, the person is in their early 40s, and the pictures we have, they do not have a massive amount of weight loss, but there is some looseness of the skin of the thighs, and the thighs don't look too bad, but they are a little emptied out, and the person also describes that they've had liposuction and some other things done, and they want their thigh skin tightened. Now, the thing with thigh lifts you have to keep in mind is that they are what I would call more of an advanced plastic surgery cosmetic operation. Not everyone does them. There are some reasons for that because they are a little more challenging, especially if you're doing them correctly. And there can be certain issues that you can get into with this operation that you're not as likely to get into when you talk about some of these more basic things that people will do. Especially people that are practicing cosmetic surgery that are not plastic surgeons. Hopefully, and what I find in observation of the real world, and hopefully in your area too, that not too many people try to do these if they don't really know what they're doing. And that's a good thing because you don't want to get people into problems. For practices that do these a lot, properly trained plastic surgeons that handle these, they're not more of a problem than typical operations. We don't have problems with them. We have a few techniques that we do that make this a safe and reliable procedure. So this person may have been in a practice where they don't do a lot of them, or they don't want to do them, and they really don't want to do this for her. But what I'll find is that if a person is a reasonable candidate for it anatomically, and they really want it done, and they understand the pros and cons of what's required, the operation, the scarring, the potential issues that can happen, if they're at least a reasonable candidate, I would rather have that done by us because I want to make sure they're going to get a safe outcome. I really don't want to turn someone away if they're a candidate for it because I don't know who's going to do this, and they might come back to me 6 months, a year later with a big problem. That is not going to help anybody. So in this case, the person can do a thigh lift. There are a couple of different ways it can be done. I would probably not recommend the down the leg scar for somebody like this because they don't have quite enough skin looseness for that procedure. But you can do the scar up where it can be hidden by shorts or a larger type pair of underpants, and get a pretty good pull-up, especially if you incorporate the anterior and posterior tissue in that procedure. And again, this is something that we can do the preliminary work, through email or telephone or something like that, but I really have to see the person in person in front of me so that they really know what's going on, where the scars are located, what other people look like that have had this procedure. And then they have to judge for themselves whether the degree of improvement that I can offer is going to be warranted for the scars that are required. And from what I hear from this person, that's likely to be a yes. And I think they're a reasonable candidate for it. But I think that discussion that we had here is what probably went on, which is why she was turned down. I don't think that she's not a candidate for it. She's a special candidate for it, if that makes sense. So I think it can be done, and I think she would get a reasonable outcome. She seemed to understand, what was going on with the procedure from the question that we got and the information that we saw.
Well, thank you, Dr. Payne, and we appreciate your time. And for the viewers out there, can you please show how they can contact you?
Yeah, we have our contact info here. Facebook, the website itself, or on Instagram. Naturally, I manage the Instagram one. So if you don't get a response back, it may take me a little while to get to it, depending on what I'm doing. But those are the avenues to reach us if there's any further questions. Hope that helps.